In this video, we will discuss about this combination therapy on human pancreatic cancer or the human PDAC. So far, in the previous video, we have understood the effect of this combination therapies on the tumors that are generated on the mice and are either cured on the same mice or those tumors are transferred to this immunodeficient mice. So here, previously we got some expected results, that is when they use the combination therapy the tumors are suppressed completely and there is no sign of relapse of the tumors. So once they get the positive results, so they wanted to check whether combination therapy also able to provide similar results on the human pancreatic cancers. So for this they took the pancreatic tissues from the patients who are affected with the pancreas, and in this xenograft 1, 2, 3, 4 they use the orthotopic injection of the tumors into the mice, whereas for this case PDX4B, PDX5 and PDX6 they use subcutaneous injection of the tumors. And also they did this whole exome sequencing to find out the other mutations that are present within this pancreatic cancer tissues that they obtained from the donor, and those mutations are shown here, that all of them behaves differently, as different mutations are present in those in different patients. So results here, the results for the combination therapies are shown, where they can see that the complete suppression of the tumors in all the cases, and they do not see any sign for the relapse of the tumors in the mice. However, when they use the dual therapies, that is instead of this combining these three drugs, DARX, AFA, SD36, if they combine any of the two drugs, then they are able to see that there is a tumor delayed, but tumor is not completely suppressed, and mice are eventually able to die after some times, or slightly delayed mice that occurs compared to the control case where there is no drugs is been induced. And also what they are able to see, that in the case of this PDX 1, 2 and 3 there is a common mutations in the KRAS, that is G12D. So they wanted to check whether this combination therapy will work with another RAS inhibitors or not. So instead of directs, they use this MRTX, AFA and SD36, and then check whether these combination therapies also provide the similar results or not, and they are able to see that tumor suppressions are there and there is no signs for the tumor relapse. So from that and after some detailed analysis of the pancreatic tissues, they are able to see a thin layer of the cyst close to the low proliferative epithelial cells that can be seen in the panel D. So this indicates that there is no sign for the tumor relapse, that there is no big tumors signs has been observed in the H&E or immunostaining. And so far, so what they finally conclude, that the combination therapies are able to work if these combination therapies include a RAS inhibitor and this dual RAS inhibitors and this dual inhibitors, another drugs that can inhibit this either that can inhibit both this EGFR and HER2, because some of the cancers has HER2 mutations and some of the cancers has EGFR, or some of them has both, and they can also degrade this STAT3. If these three can be act simultaneously, then tumors will lose its resistance against the cell death, and we can see, and tumor cells can undergo cell death using through this apoptosis, and those markers we have checked in the previous studies, where the cleaved caspase 3 has been enhanced in the combination therapies compared to the vehicle. So, and here the examples can be seen that EGFR is knocked down, or in-frame insertions or missense are observed in the PDX1 and PDX2, but there is no such thing, no such changes observed in these other tissues. So this indicates that each tumors has different mutations, but some of the common mutations, or some mutations, are mainly found commonly in the pancreatic cancers, that is KRAS mutations. Within the KRAS also there are different mutations are there, different kind of mutations observed, and the common in this PDX1, 2 and 3 that they observed is G12D. So this is what they finally conclude, that the combination therapies can work on human pancreatic cancers also. And the dual combinations of these therapies results are shown in supplemental figures. So if you need to understand more about this topic or this paper in detail, you can go through the reference that has been provided in the description. From that you can also check the supplemental figures. If you need to understand more about this topic, if you have any further doubts, you can write the comment. So thank you for your time.